Welcome back to Inside the Wellspace. I'm your host, Cathy O'Brien. Today, we're joined by a true force in the world of medicine, Dr. Holly Andersen. She is the Director of Education and Outreach for the Ronald O. Perelman Heart Institute at NewYork-Presbyterian Weill, Cornell. She's an attending cardiologist, and she's an associate professor of clinical medicine. From advising the Women's Heart Alliance to shaping the next generation of physicians, Dr. Andersen's career is a masterclass in leadership, innovation, and heart health, literally. She's been named one of New York's best doctors year after year, is double board certified, and speaks globally on preventative cardiology and cardiovascular health in athletes. Today, we dive into her extraordinary path, her passion for education, and the power of proactive care. Let's get into it. Let's start with the big stuff, which is heart disease. And we've had this conversation before, that heart disease is the number one killer of women. Can you tell us why?
Well, heart disease is the number one cause of death for both men and women worldwide now. And we've known that for men for a long time, but still the awareness that heart disease is the number one cause of death for women is very low. And it's despite 2 decades of a national campaign to increase awareness. It's decreased significantly from 64% in 2010 to 44% in 2019. And awareness is the lowest among young women. And death rates due to heart disease is now increasing the fastest among young women aged 29 to 45. And
why, though? What is going on here?
Well, we know it's increasing.
Yeah.
We also know that it's the number one cause of death now. Cardiovascular disease is the number one cause of peri-pregnancy death.
Really?
In the United States.
Wow.
Yeah. More than hemorrhaging, more than infectious disease. Really? So risk factors are going up, and they're going up among young people, and they include diabetes, hypertension, certainly stress. And they're going up fastest among women of color.
Is that right?
African-American women and Hispanic women. And diabetes is particularly among that population.
Interesting. Yeah. Diabetes is a big thing. Does weight have?
Weight has a huge amount to do with it, particularly weight and fat around the waistline.
Okay.
Because that fat is metabolic, and it's will increase your blood pressure, will make you more prone to becoming diabetic. It also makes you insulin resistant. So your sugar levels are higher and your insulin levels are higher. And that is a pro-inflammatory state, and inflammation's the gateway to disease, brain disease, heart disease, and cancer. Even if you're not diabetic, if you have excess weight in the region, it puts you at higher risk. You could be living and eating your culture's food in Central America or Africa or other parts of the world and come here and with one generation eating the same foods, people become obese. So our food supply has not been our friend in this country.
Yeah, it's true. It's a big big issue, isn't it? That's a whole
big issue.
That's a whole topic on its own.
Every cracker, piece of pasta, piece of bread has more fat, sugar, and salt in it than any other country in the world.
What?
So
God.
We need to address that.
We do need to address it. So sort of the headline, I think, and what you and I have said to each other over time is, let's just assume we're at risk. We should just assume
when it's
that
the
we're
number
at risk.
When it's the number one cause of death for both men and women,
right.
And it's increasing, and it's starting early. We can see the signs of some atherosclerosis, which is the plaque that clogs up our arteries and leads to heart disease and strokes. We can see that starting in late teens and early 20s.
Isn't that amazing?
Yeah.
So then when a woman, because we're talking about the girls, when a woman goes in for her regular exam, what should she be thinking about, and at what age is she? I mean, I'm fortunate to have you as my doctor, so I get an EKG every year when I go in, and I have had a calcium test on my heart, so I know what that is. Can you talk a little bit about both of those things and if it's relevant for people?
Yeah, I would say, first of all, I think younger women go to the obstetrician, right, or the gynecologist,
Yep.
and they might not have a primary care doctor.
Right.
But, the pregnancy itself is like a stress test for your heart. So if you have elevated blood pressure, or you have elevated sugars, or something called preeclampsia during your pregnancy, you're at a significant increased risk of future heart disease.
Really?
So, it's good to kind of assess what your risk could be, even though we're all at risk. Do you have a family history of heart disease? Did your mother have heart disease, which is a stronger indicator than if your father had heart disease? Do you have a family history of high blood pressure? Were you a smoker? What has your blood pressure been at each of these visits, including maybe when you were an adolescent? And then, then we can help decide who should be getting an EKG every year and who should be getting a calcium test, which is a very important test now. It's a very quick scan of the heart, right? It takes like 2 to 3 minutes.
Yeah.
It's
like $100, right?
Yeah, it's usually not paid for by insurance, but it's about $100. And it helps us risk stratified who we need to be more aggressive with. And usually that means who should be on a medication like a statin medication. Right. But traditionally, we have underestimated the risk in women. In every factor, in every calculator, in every study, when we try to come up with risk assessment, we have underestimated the risk for women. And so this test helps us with those women.
Let's dig into that one because that pisses me off. We've talked about, and we should all know this at this point in time, that heart disease studies were primarily done on the male body, right? Until very recently. Are we having more studies done on the female body now? How's that work?
Traditionally, most of what we know about heart disease has been done on studies of men, designed by men, and this has greatly benefited men, but women have not fared as well.
Right.
And if we took all that information and applied it to women and they did as well, I wouldn't care.
Right.
But that's not the case.
It's not.
And even when we control for all the undertreatment for women, there still is a death disparity for men, a significant one, and particularly among young women. So we need to be studying heart disease in women, the number one cause of death for women. More women die of heart disease than all cancers combined. More women die of heart disease than breast cancer at every age.
Okay, this is like stressing me out right now. I've got to do some breathing.
So, but we're taking care of your heart.
I know.
So we need to be starting sooner and our risk reduction. And we need to make young people especially aware they're at risk, because if you don't know if you're at risk, then you're not going to really be practicing prevention.
Right.
It's unfortunate because sometimes the first sign of heart disease is sudden death. So we don't get to all the time fix it after the first symptom.
No. And which this is something that I find also, annoying and scary simultaneously, is that women are statistically less likely to go to the ER, right? They take a wait and see. This is cultural, by the way. So this is
still the truth.
This is a bigger issue for us in that we just feel like it's, I don't know, maybe it's not happening. Maybe I'm making it up. Maybe it'll pass, right?
Women having a heart attack today will take on average 11 minutes longer to get to the emergency room. And then when they get there, we can talk about that. Their treatment diagnosis delayed. But it's not just women who don't know they could be having a heart attack, because certainly, 40% of women having heart attack don't have chest pain. So they may not be, and they're not recognizing their symptoms as a heart attack, and they're not thinking of themselves as someone who can have a heart attack. So they don't go to the emergency room right away.
Yeah.
Rosie O'Donnell did a whole stand-up about her heart attack. Like, she was reading the symptoms. Like, she kind of knew she had a heart attack, and still it took her like 24 hours to get there. And it's a funny stand-up. But even women who think they're having a heart attack, like they think they're having, won't call 911 right away.
They don't want to bother anybody.
I'm too busy to have a heart attack today. Right. I have to go pick my daughter from school.
Yeah.
And they wait. They take a wait and see response, and sometimes that can cost them their lives. And we also have a saying that time is muscle. But even when they get to the emergency room, we can talk about that. When a woman having a heart attack today gets to an emergency room, she will be less likely to have the classic symptom of chest pain. She will be less likely to have a diagnostic electrocardiogram. She will be less likely to have a diagnostic blood test, and not surprisingly, she'll be less likely to be diagnosed correctly. And even if she is diagnosed correctly, she'll be less likely to receive all the life-saving therapies we have to treat heart attacks today. And even
at that moment.
And even, I told you, if you can control for all of those things, she still would be more likely to die of a heart attack than men. And we don't know.
And we don't know why.
And I would say, it's women having the most serious type of heart attack are 60% more likely to die of their heart attack. It's not a small number.
No.
It's a big number.
It's a big number.
And
we don't know why.
We have to do a better job at every point along the way.
Yeah.
But this is great because making women aware.
Yeah.
That's really one of the things that we understand. We speak to physicians. We teach medical students. We teach, physicians. We teach everybody we can, but we need to arm women with the knowledge and the power to advocate for themselves.
Yeah.
When they go to the emergency room, when they go to their doctors. Hey, doctor, how's my heart? Can we check my heart?
Yeah.
A doctor who's listening to that will pay more attention.
Okay.
And I had a woman who was having her second heart attack going to the same emergency room and had to argue for an EKG. So yeah, we really want to arm women with the knowledge and power. And we started a campaign about the misdiagnosis of women's heart disease. And we did a survey this past year that we published that said that 84% of cardiologists said that they were treating a woman in the past year who had been misdiagnosed.
That was a surprising stat.
That's a big stat.
It's a huge stat.
Yeah. So women have to recognize the different signs of a heart attack. They have to think about having a heart attack first.
Yeah.
We'd rather be taking care of indigestion in the emergency room than missing a heart attack.
Right on. Absolutely. So then that comes, that's certainly as a female, we need to get stronger and better at just, I hate saying words like self-advocate, but I guess that's what it is. Or just be pushy. Do that, just stand up for yourself. You have to always stand up for yourself.
And,
push,
we're getting better and better at it, but maybe not as in the emergency room as good as we should be.
I think,
and maybe not when it comes to our health. We may be a little bit more timid. And fearful.
Fearful.
So there's no reason to be fearful. We can treat heart attacks very, very well if you get to us.
But see, this is exactly the point of this entire thing is understanding that it's all doable. It's all doable.
Get to us so we can help.
Yeah. Like with the cancer thing that you and I were talking about before. You got to you said to me when I was diagnosed with cancer, that's not what's going to kill you. Like what's going to kill you is a bus or whatever. But that was helpful. And I thought, okay, in the grand scheme of things, this is really just a wake up call. So you have to have early detection. You have to be aware of things. You have to know what you're looking for. So everything starts with awareness and communication. Absolutely. Okay, just so we are clear on markers, blood pressure, right? Blood pressure is a huge deal. And you said that it used to be 140/80 was the standard, and now it's 120/80.
Exactly.
Right? So we got to know our blood pressure.
Even when 140/80 or less was considered normal, we were not doing a very good job at getting people's blood pressure under control.
Really?
Yeah.
So what gets it under control?
So
what can we
120/80 or less is a big goal. Because we know that even, a few point drop in your blood pressure translates in a significant drop in your risk. And it's not just for stroke and heart attacks. This is how I also get people. It's like the lower your blood pressure, the better your blood pressure helps preserve cognition as you age.
I like
it.
That.
It helps protect your brain.
Nice.
That will motivate people to take their medication more or to be more physically active or eat less salt. And COVID has really made this worse. Yeah. So people stop going to get their blood pressure screened, stop going to their doctor's appointments, So the number of people with hypertension who actually have their blood pressure under control in this country is not a good number.
It's not. Yeah, and that's
something
really,
we can fix.
And
we can do it.
Okay, that's sort of like step one. Just figure out your blood pressure.
Yeah.
And there are tangible, quick things you can do. Go for a walk, get outside, eat, don't put down the bag of chips, right? Just eat healthier. It doesn't mean you have to change your entire life around. It just means,
small changes in good behaviors translate into better outcomes.
Right?
Mm-hmm.
So you mentioned inflammation before, which was really interesting to me because you were talking about inflammation inside your body, which really is the genesis of disease in general, isn't it? How do you even know if you have inflammation, if you're inflamed?
Well, I think it's hard to know, but I think you have a good idea when you feel kind of well and when you don't.
Yeah.
The way you feel right before coming down with like the flu or like some viral illness is a very inflamed state, right? That like achiness and feeling tired and feeling, you not quite knowing. Even like getting one of these vaccination boosters, how you kind of feel, So I think when you're feeling really good and healthy and your bones don't ache and your joints don't ache, I think your inflammation levels are pretty low.
Yeah.
And when you're feeling stressed and, tired, you haven't eaten well or you haven't gotten enough sleep, you don't feel great. Well,
right.
You can bet there's inflammation going on.
Yeah.
And I wish there was a simple measure of inflammation, and there's not. We do have some markers of inflammation that have helped us. There's something called a highly specific CRP, and that is a marker of inflammation, and it can be an independent risk factor for stroke and heart attack, but it's not specific to that. If you had a bad infection or even a cancer, that can increase it.
Yeah.
But there are some inflammatory markers we can check pretty quickly, but we can't check everything.
No.
It's too complicated.
Much, right?
There's too many things going on in body that are responsible for inflammation. But again, it is the gateway to disease. And I do think one of the really important measurements of good health, not the only thing, and there are exceptions, but is a waistline.
Oh, yeah.
It's not even your overall weight. It's your waistline. It's hard
that?
If you're a larger person and you have weight kind of everywhere in your body, it's much better than being a thin person with a really big belly. Right?
Yeah.
Because it is, again, that fat around the organs in your abdomen that are pro-inflammatory. Sugar, excessive weight, sleep deprivation, all go into putting fat right there. And liposuction, by the way, doesn't help because it's not the fat underneath the skin that matters. It's the fat in your visceral organs.
Visceral fat, exactly.
Yeah. So
I love that word,
doesn't help.
fat.
That's one of the most important markers of overall health, more than your weight, more than your BMI.
It's the visceral fat. How do you test that you've...
Well, a waistline. I think a simple measurement is waistline.
You can see it.
Anything you can do to make your waistline a little trimmer is going to translate into a lot of healthy things.
Yeah. Yes, it is. Yes, it is. And it's not always the easiest, but one thing...
Certainly, carbs go right there, right?
Oh, God, they're so good, though. But I know, but we're not going to have them. But one thing you did say was, you talked about sleep, which I thought was really interesting because that affects weight, too.
Sleep affects everything.
It's everything.
Every marker we've looked at is improved by improved sleep. And we are a culture that does not appreciate the benefits of sleep. And we don't spend enough time in bed, and we don't work hard enough to turn off our minds. So I will say that, improving sleep is really worth the investment. And going to bed at the same time and waking up at the same time are really, really healthy things for your body. Your body loves doing that.
Yeah.
And you kind of know that, right? You kind of know when you stay up really too late. You feel it.
You feel it. Oh,
even if you might have slept in.
Yep.
I do think that there's some feeling now that didn't used to be there that you can catch up on some sleep on the weekend. But it's better, clearly, to get a good night's sleep every night. You're not going to get 8 hours of sleep if you're in bed for 8 hours because it's normal to wake up.
Yeah.
So, and get off the screen before bed. And if you wake up, which is normal, and you go to the bath, don't turn the light on. Or if you have to, get an orange night light because those light cues are so many in our brains that'll keep us awake.
Yeah.
But it's definitely an important thing to invest in is your sleep
and relaxation. Like sort of you said something about relaxation response actually, which was pretty cool.
Yeah.
And it's this I like, the heart rate variability, which measures the tone.
Yeah,
of your
there's
heart.
something called our nervous system is divided into two nervous systems. The fight or flight system, the epinephrine adrenaline system.
I think we all
where your heart rate increases, your heart rate contractility increases, your blood vessels constrict, you're ready to fight or run or get really angry at someone.
Yep.
The opposite of that is the parasympathetic nervous system, which will relax your blood vessels, reduce your heart rate, your respiratory rate, make your heart not contract so strongly.
Right.
And one of the markers of your parasympathetic tone is something called heart rate variability, which people are starting to learn now because they're on smartwatches.
Right.
And all it is the beat-to-beat variability in your heart rate, which usually you can't see. You have to measure. Some of these watches will tell people your heart rate variability after your poor sleep, and it changes directly.
And the damage you're doing to yourself by not sleeping.
Or we'd like to look at it, the improvement you're doing when you are sleeping.
Good,
I think I did tell you, I gave a talk with the head of sleep medicine at Cornell a couple of years ago, and she's like, we can't scare people because it's too scary. We have to talk to them okay, anything you do to improve your sleep improves everything, because lack of sleep really hurts everything. And you're not gonna be able to lose weight if you're not getting enough sleep because we have the caveman's physiology that if you're up all night and running from a tiger, then you're going to eat, you're programmed to eat things that you don't normally want to or should know that you shouldn't, and you're going to store fat.
Yeah.
So
makes total sense.
You're not going to win you're not going to win this battle with these kind of hormones either.
That's what it says, right? Weight, no willpower, you eat everything, and that sleep improves / affects in a positive way your blood pressure, your heart rate. It reduces cardiovascular risk, and it can just help make you thinner.
Improves cognition.
It
makes you more compassionate. It helps with better decision making.
Oh, don't we want
any marker you look at is improved with better sleep.
So that's the first thing we should be thinking about, honestly.
I think I said, if somebody comes to me completely strung out, and they don't even know where to start because they're so stressed. They're not sleeping. They're not eating right. They're not exercising. Where do you even begin? Yeah. And I usually begin by saying how important sleep is. And the only way you can start getting better sleep in that situation is do something during the day to get your heart rate up.
Okay.
Doing some aerobic physical activity getting that sympathetic nervous system to fire a little bit in a healthy way will allow it to come down in a natural way.
Yeah.
Will allow you to relax, will allow you to rest and allow you to get the improved sleep.
So with that whole right brain activity thing that is so important, helps the parasympathetic nervous system, right?
Well, I think most of us and most of my patients who can't sleep, one of the reasons is they can't turn off that internal dialogue in their head.
Yeah.
They're thinking about everything they have to do or what somebody said that made them angry or all the things that they're worrying about, and they can't stop it.
Can't.
In the middle of the night, it's not the best time to figure out how to stop it.
No.
It is good to try to think about what you were thinking about right before you wake up, and you're not going to wake up from a dream unless somebody wakes you up, but you might be waking up of a thought or a color or a vision, or try to think about a leaf falling down from the sky. But it's really important, I think, also to invest some time in during the day, during your life, knowing how to turn that internal dialogue off. And that's the left brain. That's speech. That's talking.
Yes.
And that's not you. It's just you decide to pay attention to it or not.
Right.
But doing things that enhance more right brain, music, nature, art, visual things, all help.
So the grounding thing that people are talking about these days, it's where you're like literally touching the earth, but in the past they would just call it like gardening. Now people are,
I think there's something really to this with respect to biochemistry and physics, with respect to the charges on your cells. I think it's really healthy to not only, however, is it incredibly healthy to be in nature, to be in grass or to be in the ocean or to be on the beach and be, surrounded by beauty and feel the wind on your face and natural light, sunlight, and not indoors. That's incredibly healthy.
Sounds so good.
But I do think that there is something to be said about the grounding effect of never touching the ground and only being on shoes and only being on artificial surfaces, and what our ions are doing in our bodies. Those ions are just charged particles.
Yeah, but they're in you, and they're energy in you.
So grounding means like you're actually balancing that.
Isn't that fascinating, though?
Yeah, I think it is fascinating.
That's one thing of the many that it's changing within our bodies and our physiology now, in our culture now, this very westernized culture that we live in, which speaks to younger heart issues, younger cancers, younger all this stuff, and the toxicity that is present.
And also talking about the language model is what we stress in education, our whole system. We've really not appreciated the arts, and we've not appreciated music, not in our educational system. That we have, we can write and we learn how to write and we read and write and we're critical with all of that. But most people, if you ask them to draw the same way they did when they were in 3rd or 4th grade.
Yeah. No,
because they haven't.
It's not cultivated.
Yeah, cultivating music, cultivating art, cultivating nature, seeing the bigger picture over logic, which is important too, is really, really healthy. And we need to be more balanced. And I think everyone's recognizing that.
Thank God, right?
Now that we have AI that can do everything left brain, we need the creative.
We can delve into we've got agency and time and the ability to go right brain.
Right. And it's going to be needed and appreciated more.
I think now especially it sure is. The music thing, I'm so glad you brought that up, because that is something that you're very passionate about, aren't you, with music?
I am.
You're doing work in music too.
I spent some time, I had a little extra time to read during COVID. So I went back and read a little bit about quantum physics and philosophy.
As one does.
But, music plays into that so much. And I played an instrument when I was younger. I played the violin, and I played in an orchestra and a symphony, and I played in a chamber music, and I played with other people in front of an audience, and really nothing replaces that.
No.
I love music. I love going to concerts. Incredible. And I missed that during COVID.
Yeah.
So when you look at, when quantum physics is the study of matter, and when you get smaller and smaller and smaller into matter, there is no matter. It's only vibration. Oh. So everything is kind of energy and vibration, and all our cells are vibrating. And when you think of music as sound and sound as vibration, then it has a way to physically and to move us and emotionally move us. And it does, right? It's the only art form that really can make people cry. 90% of people said they cried to music.
Totally.
And we don't just hear it, we feel it with our bodies.
We feel it.
And then when
always.
you look into the physiology and all our cells are vibrating, especially our brain, nervous cells are all electrical, then music, coherence in music can probably bring coherence into the body, and disease cells are vibrating at a different level.
Right.
And to bring that dissonance into consonance and resonance is, I think, really important. And every ancient civilization that we've studied has used music for health and healing.
Oh, of course.
The Vedics, the Gregorian chants, the Native Americans, the African drumming, and it's healthy, right? It's like we don't really need science to prove it. When it's healthy.
Yes.
And you go to a concert, and I went to the Bruce Springsteen concert when I was there in Barclays Stadium, and everybody there is in sync, right? Our bodies are moving together. We're all happy and we're all smiling, and the happiest people are the people on the stage performing.
Yeah.
Nothing else can do that.
No.
Not one other thing can bring us together and connect us like that. And I think we need music to connect us more than ever.
That is so beautiful. It is beautiful, actually. And when I was growing up and going to college, that I called music my drug of choice, because it was the only thing that could make me feel differently.
Well, it's so interesting that you said that, because every part of the brain that we've mapped, music uses.
Really?
Is processes music, including those centers in our deep, ancient limbic system brain that control for reward and pleasure. So the same things light up with music as light up with orgasm, with chocolate, with cocaine. So it can actually help people who are addicts get off of it.
Really?
Because it can...
it serves as
it can feed that
alternative
part of the brain that wants to be fed.
Right.
And it does.
Right.
Yeah.
Wow, that is heartening.
Yeah.
I like that a lot. We've got to figure out how we can do.
We've used music. Music can help respiratory rates and heart rates in people who are sickest in the ICUs. And we brought music into neonatal ICUs, and we can see newborns also kind of respiratory rate respond to it.
God, I love that. There's a thing on Instagram now too, where this musician goes into a field and plays music for animals. Have you seen that?
I have seen it.
Isn't it the greatest?
It's the best.
And the animals come to him from a field, all different kinds of animals.
Yeah.
He goes to different fields, and then they come and they lie on him or put their little head on him while he's playing the music. It's just the cutest thing.
I agree.
I know. Okay, to just sort of flip completely into chronic stress. That is something that we take in, as a culture and a society. And it just is, it is there. And it's almost, I want to say, like a cultural badge of honor right now, is to be stressed out. And I'm so stressed out. And, are these the people? I know we talked about how the chronic stress is, it increases the wear and tear on the heart, but that a type A woman who's always like, is not at a great risk as a woman who is quiet or maybe not so assertive, or what's that all about?
So type A personality, which is always like the time-stressed person, right? The person like always waiting to do the next thing, was defined in men. Type A personality in men. And it is a risk factor for cardiovascular disease in men. Men who are incredibly time-pressed. They're always on the move, always thinking about the next thing, always, gregarious about everything. But women who are that way, I'm sure it increases their risk compared to women who are not that way. But the women who are at the greatest risk are the very docile, stay-at-home woman who has no agency over any part of her life.
Yeah.
Like, she's not in charge of the finances. She's not in charge of what they do. That woman is at the highest risk.
Yeah.
Yeah.
It's so funny. I remember when I was embarking on a divorce, and I was, like a little freaking out, just saying, I need medication. I don't know. And you were like, I'm not worried about you. You're going to be fine. I'm more worried about the women who are sitting home and don't, who maybe aren't working or who aren't out there knowing that they're going to just figure it out.
Yeah.
So.
And women and men, but that hold everything inside.
Yeah, yeah.
If you the
stoicism,
or the people,
or fear.
The people I know who have committed suicide are not the people that have really, really reached out for help. It always is somebody like, they kind of live with the silent depression.
Oh, God. Well, that's good to know because the people that I know who get depressed are talkers.
Yeah, well,
so
that's
that
better.
Makes me happy.
That's better.
Okay, good. That's a relief.
It is good to talk about things.
Okay, good. That is actually a really big relief to me.
It's good to talk about things. I'm not sure it's good to talk about things over and over and over and over again.
Right. Like that's that brain swirl that you don't want.
The process, talking about your problems, talking about your trauma over and over and over again.
No.
I don't think it's a good thing.
I agree with you. I think you need to discuss it and then move on. Because what?
Move on.
What are you going to do?
Look at your future.
Just go. I acknowledge it, of course.
Live in the present.
Yes.
Do you have a problem right now?
Right now I'm good.
Yeah,
are you good right now?
Be in the present. The more we can live in the present moment, which is hard, the healthier we're going to be and the happier we're going to be. Because really, that's all we have, right?
Yes, I know that. And coming back to that stinking cancer diagnosis, I was like, oh, I guess nothing else really matters,
Right.
So you need a little something to click you and just say like, okay, now, Dr. Andersen, we have so many things to think about. So I would love to be able to synthesize all of this great information for our ladies to walk away and say like, what if you were to say, okay, here are the 3 or 4 things that you need to do sort of starting now to manage and take care of your heart health, what would they be?
Yeah, well, I think the simplest thing to remember is really, what my grandmother said, and that is get a good night's sleep, eat your fruits and vegetables, go outside, run around and play with your friends. Sleep, physical activity, diet, huge. Social interaction with your friends. And my grandmother would also say your prayers. So aside from that, I would say be grateful because we are learning so much about how important it is to be grateful. And I know that that's a feeling, but there are activities that you can do to enhance that feeling. And when we study that, just like writing down 3 things in the morning that you're grateful for, has significant effect on mood, on your overall mortality risk, and cardiovascular risk.
Amazing.
So those are really simple things. When you go to the doctor, we'd like to arm you with a little bit more information to be your own advocate. And we have a very simple checklist at our Women's Heart Alliance.
Great.
womensheartalliance.org, #HeartChecked. But you want to know what your blood pressure is.
Yep.
You want to know what your family history is and tell your doctor about it. You want, smoking is a big risk factor. Know what your cholesterol levels are. Know if you're a pre-diabetic or a diabetic. And also, especially for women who have migraines with aura, women who have any pregnancy complication that we spoke about, high blood pressure, high sugar, or preeclampsia, women who have some rheumatological disorders like lupus or rheumatoid arthritis are also at a higher cardiovascular risk. So we love for women to know this and go into their doctors and just say, if you forget everything, say, hey, doc, how's my heart?
Great.
I hear it's the number 1 cause of death. How's mine?
There you go.
And you're going to be paid attention to more.
I love that. That is it. That's great. That's great. Thank you. Thank you for so much for this. We could talk a lot longer about many things. Really appreciate. Is there anything else that you think you should impart while we have you here?
I don't know. I was thinking of a funny story that we kind of got off the topic, but you were asking about historically. Well, we didn't study women's heart disease at all until we had Bernadine Healy, who was a female cardiologist and first female head of the NIH.
Okay.
And she started the Women's Health Initiative, which is the first prospective trial on prevention of women in this country.
Amazing.
And she wrote an editorial to the New England Journal of Medicine about the Yentl syndrome. And the Yentl syndrome, this is the early 90s. Okay. The Yentl syndrome...
Not that long ago, by the way, let's say.
Not according to our kids, but the Yentl syndrome is about the movie that Barbara Streisand had to dress up like a man to get an education.
Oh, right.
So if the women's heart disease looked like men's disease, meaning they actually had an angiogram, they saw the plaque that looked like men's disease, then they got treated. But if they didn't, they weren't really getting treated adequately. That was a long time ago. And I wish I could say that we're in a better situation now because women's heart disease is still under-researched, underdiagnosed, and undertreated at every point along the way. And only 36% of the participants in cardiovascular research trials are women, even today. So we still have a lot of work to do.
We have a lot of work to do.
Which is why I can't retire yet.
We need to do this. We need to take charge is the bottom line because the system and the medical system is not doing it for us. So with this information and this knowledge, every single one of us just needs to take charge. Like you go get a mammogram every year, deal with your heart. Same thing.
Get your heart checked.
Just get your heart checked. Be prepared and do it like starting now, right?
Absolutely.
Okay, then. Thank you.
Thank you.
It's great to see you.
Always a pleasure.
Thanks. Thank you so much for listening to this episode of Inside the Wellspace. Subscribe now on Apple Podcasts, Spotify, YouTube, or wherever you listen to your podcasts.